think it is a crisis. I think that, we've talked about trying to achieve herd immunity, but to achieve that you need to have at least 93 to 95% of the population immunised. So we don't have herd immunity.
Immunisation rates in South Auckland are among the lowest in the country, resulting in staff struggling to contain the measles virus. Despite widespread media coverage, Dr Hulme says there's a serious problem around understanding exactly what measles is.
The patient I spoke to in the weekend who had measles and has had it confirmed as measles said that she was 20 and she had not heard anything about it on TV, radio or in the papers. And the only reason she became aware of measles was through Facebook. And she saw a picture of a baby that had measles and she thought it only affected babies. She was still at work. She was one of 9. Of those 9 people in that household, one of them went to a local high school and was still going to school.
We talked about the figures that are here. 70% of confirmed measles cases are in Counties Manukau district alone. Working here, being a doctor here, this is your community. How does that make you feel?
It's pretty scary because on that day that she came, there was a market out in the car park. So, to think that you've got people with measles in the local market, it's pretty scary.
Dr Hulme says the culture of the community means people are actively social, regularly attending church and community events. It's one of the factors that has caused the district to see the biggest rise in measles cases in the country over the past 3 months.
For this young girl, for example, who had measles, she came in to see me, she had the rash. I explained to her that I went through her period of infectivity and we worked out that, when her infectious period started, which was 5 days before the rash started. And I explained to her and her partner that everyone that she had seen in the last 5 days has been potentially infected, unless they're immune.
And the community's high deprivation means many families are living in overcrowded homes, another serious concern for medical staff.
So we go through who were the high-risk people that she may have been in contact with. Also, we then went through with her who were the family members, and that's how we came up with the 9 family members that were in the same household, and got their ages, got who was at school, who was at work, and she'd been at a workplace that, until she realised that she had the measles, she'd been at work thinking that perhaps she had a flu.
What was her reaction? Did she realise the scale of how important this was or how serious this was?
I think it shocked her. And I think that shocked her so much that when I went to print off the letter for her employer and for her brother who went to high school, before I could bring those letters back to her, she had left. So I think she was in shock.
Dr Hulme says he was immediately worried when the young woman, who was not vaccinated, left because hundreds of people were outside at the local market and he had wanted to give her a face mask. Many clinics have isolation rooms, but local residents told First Up people are being asked to wait in their cars if they suspect they have measles. Dr Hulme says staff are prepared to go out to the car parks and see people in their cars.
Not everyone's got a car. And so it's not always possible for someone to wait in the car. So if they've got a car, we're certainly encouraging them to wait in the car.
And you go out to them?
And we go out to the car. Otherwise, they come into an isolation room and we see them in the isolation room, and then that room can't be used for 20 minutes after the patient's been seen.
Dr Hulme says staff are now seeing measles cases every day. His message to the community is urgent, and he says local residents need to wake up and take measles seriously.
It's a serious condition. It is a public health emergency, and I think that I'd encourage everyone to get immunised for themselves and for their loved ones.